Those variants, we've been talking about this, how the coronavirus has changed since the beginning of the pandemic, but the vaccines have stayed the same. The scientists haven't altered the way they make vaccines despite the arrival of all the different variants we've talked about over the last year. And it has a lot of people asking why. So here's our why guy, all new for you this morning.
Altering a cake recipe to better fit your taste can be as simple as adding some milk. When it comes to the coronavirus vaccines, changing the recipe isn't nearly that easy. Each year, scientists predict which strains of the flu virus they believe will be most prominent, then custom design the vaccine to target those strains. Despite the emergence of coronavirus variants, the COVID vaccines have stayed basically the same. Let's explore why. Dr. Grace Gowda of UGA's College of Pharmacy says, first and foremost, the current vaccines are offering good protection from the current variants.
There has to be a scientific reason to do the change.
Dr. Gowda tells us the COVID vaccines prompt our body to produce several different antibodies. Scientists would need to test any modifications to make sure they prompt the right antibodies to address Delta and other variants. There's no guarantee it would work any better than the original.
There's enormous amount of work that needs to be done in order to get the modified vaccine to the market. So it doesn't make any practical sense.
Scientists have decades of experience dealing with the various strains of the flu and have learned how to anticipate and adjust the vaccines. The coronavirus is still relatively new. Vaccine manufacturers are in the process of studying variant-specific boosters.
They probably have some ideas of where the modifications should occur.
Dr. Gowda says vaccine manufacturers have made minor adjustments but won't need major modifications as long as they have the upper hand against the coronavirus and its variants.